Hello and welcome to our postnatal information video. We will be going through lots of advice and strategies to help you manage any discomfort you may experience throughout your postnatal period and help you answer any questions you may have. This picture is of a female pelvis, which has a large opening in the centre which acts as the birth canal. Around the pelvis there are a lot of muscles and ligaments which help to hold the pelvic joints in place. During pregnancy, there are many changes to the body, and sometimes you may experience discomfort or pain as the body tries to cope with the pregnancy changes. But this is completely normal. Usually, these pains resolve shortly after having your baby, but sometimes they may take longer. The muscles around the stomach stretch and lengthen during pregnancy. In pregnancy, our rectus abdominal muscles often separate as the baby grows. This is perfectly normal. This separation is called a diastasis recti. These muscles generally return to normal after the birth, within 6 to 8 weeks postnatally. However, for some people, it can take a bit longer. If you are struggling with this ongoing separation postnatally, you can seek help from physiotherapy to improve this. If you want more information on this and exercises to perform, see the dedicated diastasis recti film. Weight gain in pregnancy varies greatly. Most women gain between 10 and 12.5 kilos, 22 to 28 pounds, putting on most of the weight after week 20. Much of the extra weight is due to your baby growing, but your body will also be storing fat, ready to make breast milk after your baby is born. In the postnatal period, if you are overweight or have concerns about your weight, you can ask your GP for support and advice on safe weight loss in the postnatal period. Ensuring good posture after you have had your baby is important for you looking and feeling better and for reducing the risk of future aches and pains. Your pelvic joints may take time to return to their original state after having a baby, so try to avoid extra stress and strain such as bending, lifting and twisting where possible. If you do have to carry out activities which include these actions, try to modify how you do them, so they are as comfortable as possible. Carry any loads, including your baby, as close to your body as possible, and ideally centrally rather than on one side of your body. Bend your knees and keep your back straight when picking things up or putting them down. When sitting, try not to slouch and sit in well-supported upright sitting positions. For example, when you are feeding, always sit well back in the chair or bed. A small pillow or folded towel placed behind your waist will support you and may help to relieve any backache. Your feet should reach the floor. Pillows on your lap will encourage a better posture for a comfortable feeding position. Bring your baby up to the correct height for you rather than you bending forwards to your baby. Rest back as you feed, making sure that your shoulders are relaxed. Lying is a comfortable position for most women postnatally. Lie on your side and make yourself comfortable by placing pillows under your abdomen and between your knees. This position can be good for sleeping and breastfeeding. Lying on your side can be particularly comfortable if you have had stitches in your stomach or perineum, or if you have piles. If you are struggling to get a comfortable and successful position for feeding your baby, request help from your breastfeeding support worker or midwife. When standing, try to remember to keep your feet hip distance apart, your weight evenly distributed over both feet. Keep your knees soft, tuck your tailbone under, pull your tummy button in towards your spine, lift through your breastbone, widen through your collarbones, taking your shoulder blades down and back, and lengthen through the top of your head. Don't poke your chin out. Wear good supportive footwear with shock-absorbing soles like trainers, and avoid flip-flops or flat shoes like slip-on pumps and Uggs. Avoid wearing high heels because it changes your posture and puts extra pressure on your lower back and pelvis. When changing your baby, try to lift from a surface rather than the floor. If possible, change the baby at waist height either on a changing table or any other safe, suitable surface such as a tabletop. Bend your knees, keep your back straight, and keep your baby as central and close to your body as possible. When lifting the baby up, repeat the same actions, bend your knees and bring the baby close to you. If safe to do so, you can use one arm to support as you stand up. With all children of any age, do not carry the load of a child on your hip, as you want to avoid one side lifting. A baby carrier or sling can help you carry your baby centrally. When putting your baby in and out of the sling, consider your lifting technique. Bend your knees, keep your back straight, tighten your pelvic floor muscles, and hold your baby close to you as you come into the upright position. There are many different types of slings and carriers, and one size does not fit all. It may be a bit of trial and error to find the one that is most suitable for you. Lifting your baby in and out of the cot and bath can also be difficult. If you can, try to adjust the height you lift from, such as having the cot mattress at the highest level that is safe to do so. This may not be possible for all activities, but at whatever height you are lifting from, always follow the good lifting techniques. Keep your baby close to you, bend your knees, keep your back straight, tighten your pelvic floor, and lower your baby safely into the cot. When lifting your baby out, follow these steps again. Follow similar steps when bathing your baby. However, if the surface is much lower down to the floor, you could lower your body and come onto your knees, as seen here in the video. Car seats can be very heavy, and putting them in and out of the car, if not done carefully, can cause a lot of unnecessary twisting movements. Carry the car seat with two arms as close to your body as possible and at waist height. Put the car seat down on the ground, then open the car door to avoid having to carry the car seat in one hand. Pick the car seat up, keep the car seat close to your body, and step round with your feet to avoid twisting, and then carefully put the car seat in the car. Follow the same principles when you take the car seat out. Follow the same process when putting the pram in the car. Make sure you keep the load close to your body, follow good lifting techniques. Always try to bend your knees, tighten your pelvic floor muscles, keep the object you are lifting in front of your body, and turn moving your feet to avoid extra strain and twisting. With small children, avoid lifting where possible. Encourage them to be independent. Go down to them on one knee or a squat, and encourage your child to climb onto your lap when you are sitting. Try to encourage older children to do as much as they can. For example, encouraging them to climb in and out of the car themselves, if safe to do so. Many women feel extremely tired after childbirth, so do not overdo it. Pace yourself, limit your visitors, and have plenty of rest. Do not try to be super mum, and accept offers of help and set aside a regular time to rest, and always listen to your body. When doing everyday tasks, try to spread them out, remember good lifting techniques, and modify them if required. You can start gentle exercises when you feel up to it. Returning to exercise should be gradual. It is better to wait until your 6-week checkup with the GP before starting any high-impact exercises. You may wish to wait longer if you have noticed any signs of incontinence or prolapse, as it takes time for your body and muscles to strengthen up again. Brisk walking is a good form of exercise and can be started as soon as you feel comfortable to do so. Ensure the pram handles are at a correct height for you so that you do not have to bend forwards or reach upwards. Gradually increase the time and pace of your walking every day during the first 6 weeks. You can start swimming once you have had 7 days clear from vaginal bleeding or discharge. If you have had a caesarean section, you may need to wait until you have seen your GP at your 6-week check. Care should be taken not to start high-impact activities too soon, where both feet leave the ground at the same time, such as jumping, jogging, or sports that involve running. Everyone recovers at different rates. If you have exercised regularly prior to your pregnancy, you may be able to return to fitness more quickly. Pelvic floor muscle exercises. The pelvic floor muscles are a hammock of muscles underneath your pelvis. They are attached at the front of the pelvis to the pubic bone and span backwards to attach at the base of the spine around the sacrum and coccyx. The opening of the vagina and the bowel all pass through the pelvic floor, and they help to support the baby's weight as it grows. It is beneficial to start your pelvic floor exercises antenatally and continue them postnatally and longer term to maintain and build strength and endurance. How to do pelvic floor exercises. A pelvic floor muscle contraction is performed by closing and drawing up your back and front passage. Imagine you are trying to stop yourself from passing wind and at the same time trying to stop your flow of urine. Then draw up inside as if you are trying to lengthen your vagina. The feeling is one of squeeze and lift. In the beginning, it may be easier to do the exercises in lying, but you can progress them to sitting and standing. There are 2 types of exercises you should do. Quick and strong, squeeze as hard as you can and then relax completely. Rest a second and then repeat up to 10 times. Endurance, squeeze and hold for up to 10 seconds. You must feel the muscle relax after each contraction. Aim to repeat it as many times as you can, building up to a maximum of 10 times. Do not pull in your stomach excessively. Do not squeeze your legs together. Do not tighten your buttocks and do not hold your breath. You must aim to do these exercises at least 3 times a day. Generally, it takes 3 to 6 months to get a muscle really strong again. Do not do so many that the muscle begins to ache. Remember, it is quality, not quantity. The pelvic floor muscle exercises do not take long. They can be done when sat in traffic, in a meeting, or when watching TV. Just ensure you make them part of your daily routine. If you are unsure of how to do your pelvic floor muscle exercises, then please do ask for help and support from your physiotherapist. If you have had a caesarean section, do not expect too much too soon. There are stitches in your lower abdomen that will take time to heal, so increase your activities gradually. When you return home, accept all the help that is offered. Take regular pain relief for as long as you require it. Rest by lying on your side and make yourself comfortable by placing pillows under your abdomen and between your knees. When sitting, ensure you are positioned well back in the chair with good support in your lower back. In the early days, if you need to cough or sneeze, lean forwards and support your wound with your hands, a pillow or small towel. Try to avoid any activity that causes strain for the first 6 weeks. For example, prolonged standing, housework, and carrying heavy things. Don't lift anything heavy for at least 6 weeks. For example, heavy shopping bags, washing baskets, and furniture. Incontinence and prolapses can occur after having a baby, or for other reasons throughout life. Doing pelvic floor muscle exercises long-term may help to prevent this. You may also experience constipation postnatally. It is important not to strain when going to the toilet and manage any constipation you may have. If you want more information on bladder and bowel management and exercises to perform, see the dedicated videos or contact physiotherapy for more support. Some women prefer to wait until they have had their 6-week postnatal checkup, but if there are no problems, you can resume sexual activity when you feel ready for it. You may want to use lubricant and start gently. If you have persistent discomfort or pain with sexual activity, ask your GP for further help. Remember to speak to your GP about contraception. If you have any questions postnatally or need further advice or support, then please do not hesitate to refer to our perinatal pelvic health services and request an appointment with a qualified physiotherapist.